I think nearly every member of this body shares the goal of increasing access to affordable health insurance and helping American families receive the best coverage to meet their specific needs. So the question before us today, and the question before us this entire Congress, has been, how are these goals being achieved? This really has been an issue we've been debating since 2010 when President Obama's health care law was enacted. Well, I can tell you, based on the extraordinary level of feedback from Hoosiers, regardless of party affiliation or ideology, whether they're Republicans or Democrats or independents or libertarians or wherever it's coming from, the overwhelming messages that have been sent to me as I've heard traveling across the state of Indiana, as I have read in the emails, hundreds and thousands of emails and phone calls that come into my office, is that we're not meeting these goals, and that the Affordable Care Act has turned out to be a dismal failure. It's hurting more families than it's helping. And now, to top it all off, the administration last Friday late afternoon, I think in hopes that not too many people would notice, cuts once again one of the most popular programs available to seniors, Medicare Advantage. We have 230,000 Hoosiers enrolled in Medicare Advantage plans. And they're being told that major cuts will be made in their plans, in what is proposed in their plans, and premiums will increase in their plans in order to pay for the rest of Obamacare. What an irony here. We pass a program to provide health care coverage for senior citizens. They sign up for the program. They make the choice on their own to pay more for Medicare Advantage so they get better coverage. And the administration simply says, well, we need to rebalance things out, and so we're going to do everything we possibly can to make it more difficult and more expensive to join Medicare Advantage, their choice. Instead, they're saying, we're going to make it our choice, that this program is going to be reduced and much harder to engage in. Consider what's happening here. This administration is cutting billions of dollars from Medicare Advantage, an extremely popular program, not just in my state, but across this country, to pay for the Obamacare plan, which is extremely unpopular. So you take a plan that works, you take a plan that people support because it's their choice, are willing to pay for it, and you say, no, we're going to take that away from you so that we can cover the cost for a plan that is not popular. It's just the irony of ironies, particularly in terms of meeting the goal that I think all of us want to meet. So here we have yet another broken promise. The president so famously saying over and over again, if you like your plan, you can keep it. If you make a choice as to how you want to be covered, what benefits you want to have, what premium you want to pay, you can keep it. Turning around now and saying, well, no, effectively, you can't keep it because we're going to take that away from you. So it's no wonder that I receive the hundreds, if not thousands, tens of thousands of feedback from Hoosiers all across my state, basically saying, I got duped here. I got lured into something that supposedly was going to make medical care less costly, and that I would be able to keep my doctor, I would be able to stay with my hospital, I would be able to keep the benefits in the plan that I chose, and now I'm being told that no, none of that is going to work. Now, as was just stated by Senator Cornyn from Texas, Mr. President, there's bipartisan effort underway to send you the message that to not take this money away from Medicare Advantage and not mitigate or decrease the incentive to join Medicare Advantage. So I know, Mr. President, you don't want to listen to Republicans and have them tell you what they think is happening in their state, what they believe is happening in their state, what they think their suggestions as to what we ought to do to try to fix this disaster of a health care plan. But why don't you listen to your own members? There are a significant number of Democrats that have said, we don't want these cuts to be imposed on Medicare Advantage. We don't want to go home and tell our people they can't any longer have their Medicare Advantage plan. So if you don't want to listen to us, I fully understand that. You've made that very clear. Why don't you listen to your own members and listen to what they're saying? And let's try to fix this thing or repair this thing to the extent that we can and give people the ability to make those choices and to participate and keep the plan that they have chosen and not have it taken away by a bureaucracy that simply makes decisions for them. Mr. President, with that, I yield the floor.